Have you ever wondered what really goes on at an Underfive clinic? Well, say no more. Grab a piece of paper and let's go. Hello and welcome to MK's Medical Review Series. My name is Dr. Moses Kazevu. This is a series on my YouTube channel where we'll look at medical topics in depth. Today we're going to be looking at the Underfive Clinic as well as the Underfive card. So if you haven't yet subscribed to the channel, what are you waiting for? Hit the subscribe button, hit the bell notification icon to be receiving notifications of such videos every time I post. Grab your piece of paper, tell a friend that we're covering more topics on the channel, and let's go. So remember that the whole point of the Underfive Clinic is that this is pretty much a center that's going to be providing preventive, promotive, curative, referral, as well as educational services. And all this is going to be offered in a packaged manner to the Underfive child under one roof goal. And this goal is that we're going to be providing comprehensive health care in young children or to young children, especially those that are under the age of 5 in a specialized facility. Now, what are our aims and activities? We want to provide care for children that are in illness. We want to provide growth monitoring. We want to provide preventive care, as well as at the center of all this, we want to offer family planning. So remember that children are going to be treated for both acute and chronic illnesses that are going to be affecting the growth and development. So the nurse actually has a huge role because most of the nurses are the ones that are going to be running these clinics. So a big shout out if you're a nurse, know that you are very important and you are loved. And of course, there is growth monitoring where we actually look at the weight of the child, the height or the length of the child, the mid-upper arm circumference, and then we plot these on a growth chart. I will show you another Underfive card at the end of the lecture. Then of course, every month, the child should actually visit the Underfive clinic every month during the first year. So it means that they're going to be visiting 12 times. Then every 2 months from 1 year to 3 years, then every 3 months during the 4th and the 5th year. So that's how the schedules are going to be done. And every time the child actually attends the clinic, remember that they have these clinics pretty much on specific days. So for example, if you have the clinics on a Thursday, then you have to book in advance to attend the clinic. Additionally, we want to offer some preventive care, so physical examination of the child, immunization of the child. I did a video on immunization schedule in Zambia, so click here to actually check that out if you haven't yet watched the video. Then I'll leave it tagged at the end of the video as well. We also offer nutritional care, so vitamin supplementation in addition to this, as well as oral rehydration therapy. Now, we do offer family planning to mothers, and we actually have realized that mothers are by far much more receptive during the period of the early puerperium, meaning remember that the puerperium is the first 6 weeks after delivery of the child. So during the early phases of this puerperium and during the process of lactation, mothers are receptive to family planning. So we want to counsel the mother on family planning and offer her available options. In addition to this, we want to offer health education. So we educate the mothers about child care, we educate them about breastfeeding practices, we educate them about nutrition, about growth monitoring, about immunization, and cleanliness. So the role of the healthcare personnel is actually to select the place and the days in which you're going to be having the clinic, to arrange the equipment, to arrange the entertainment facilities, to provide immunization services, to give warm welcome to obviously the mothers and the children, to maintain the growth charts and the immunization charts, to record the general examination findings, to also carry out physical examinations, nutritional levels, as well as the weight of the child, to assess the growth and development in short. We also want to prevent and treat any general diseases and injuries, and those that are critical, we want to refer them to facilities where they can actually get the help. We also want to provide health education to the mothers, and we assess the growth and development of the child, which is repeated for more emphasis. Now, a big shout out to the nurses. If you're a nurse watching this, a big shout out to you. So the role of the nurse in the under 5 is, of course, to treat the minor illnesses, to refer the most seriously ill children to facilities where they can actually get help, as well as instruct about feeding, nutrition, and hygiene, encourage child spacing and family planning. So they actually do conduct these meetings. These under 5 clinics, if you want to see a typical one, just visit one of these rural health centers. And if you visit one of these rural health centers, then it makes it very, very easy for you to learn about this under 5 and the things that are done in the under 5 clinic. We also want to maintain the child's weight cards and the road to good health cards. Then, of course, the nurse should also be alert in every condition so that the effectiveness of the service can actually be improved. So here's an old under 5 card, an example of an old under 5 card, because I want us to compare and contrast the older card to the newer card. As you can see here, there were some immunizations that were added. I talked about that especially in the immunization video that I'll leave tagged at the end. Of course, this part here on the demographics and the child's information is pretty much the same. This part here is pretty much the same. This part here is pretty much the same. This was pushed to this bit here, this part where it says the mother was pushed to here. Then this part is pretty much the same. Immunization has changed. There were some vaccines that were added. Then, of course, this PMTCT and this feeding codes here are just the same as well. And this section is the same, as well as the growth charts at the back are largely the same. You have specific under 5 cards for specific genders. So the girls are going to be receiving a pink card. Then the males are going to be receiving a blue card. So you can't take a blue card and then use it in a female, because that would be rather redundant. And because the growth of females is not the same as the growth of males. So take note of that. If you have been doing such a practice, then know that you're doing the wrong thing. So here's the new under 5 card. A big shout out to Sarah for actually providing me with this under 5 card that is rather awesome. So we'll start with the back side here. So we divided into 4 sections, as of course is going to be a brochure that you can actually fold about 3 times into 4 sections. So this is the child's particular, so pretty much the name of the health facility, the child's number, that's the number, the patient number or the under 5 card number, the child's name. Here where it says boy or girl is rather redundant according to me, because if this is meant for a boy, then why should you have a girl over there? Then, of course, the mother or the father's or the guardian's name, as well as the national registration card number. The date when you first saw them, the date of birth, the birth weight, the place of birth, and where the family actually lives, the address. Then, of course, here you tick if the child has any of the following things. This is rather very self-explanatory. If the child had a birth weight less than 2.5, we tick. If there are any other reasons why this child requires special attention, like a special condition, you indicate that here. Then, of course, for deworming the children, we want to deworm children that are above the age of 1 year. So pretty much we give them 500 milligrams of mebendazole every 6 months, and then we'll of course record that. Then on the immunization record, I won't spend much time. You just give the immunizations and we sign across the date. There were also some changes that were made to this. I think IPV is now being given, as well as rotavirus, as you can see, PCV, as you can see, was added to this. Then of course other immunizations that can be given should be put over there. Then of course vitamin A supplementation is given to the infant. This section here is for the infant, this section here is for the mother. So in the infant, if it's 0 to 5 months, 50,000 international units only if they're not breastfed. If they're 6 to 11 months, 100,000 international units. If they are 12 to 59 months, that's just underneath 6 years, that's going to be 200,000 international units every 6 months. Then of course you record the date and the dosage that was given. Then of course the mother must be given 200,000 international units as a single dose. This is usually given immediately after birth or within 2 months of delivery. Now this section here for prevention of transmission of HIV/AIDS from the mother to child, there are some abbreviations that I want you to know. So CE here simply stands for child exposed. Remember that we don't say that a child is HIV positive necessarily just because they are born from an HIV positive mother. Remember that how we test for HIV, we pretty much look for antibodies in the serum. So we pretty much want to be looking for antibodies, a specific antibody against the P24 antigen on the HIV virus. So these are immunoglobulin G antibodies. And remember that these can cross over to the placenta, they can cross over to the fetus. So it doesn't necessarily mean that if you get a positive serological test in a very young child, especially those that are below the age of 1 year, that this child is necessarily having HIV. All you could be doing is pretty much testing the antibodies that the child may have gotten from the mother. So this just simply stands for child exposed. MSU means for maternal status unknown. CNE is child not exposed. And then of course you record the date in which the test was done, then your name, if you whoever you tested this, and of course whether it's reactive or whether it's non-reactive, or you are not able to determine this, then of course the MGA here and the IGA is not maternal gestational age. So this just simply means for maternal given or mother given antiretroviral, we tick, or infant given antiretroviral, we tick. And of course, if the child has been given cotrimoxazole prophylaxis or cotrimoxazole as a drug, we actually indicate this here. Then if the child was found with, of course, HIV positive and they're referred to the ART, we record the date, as well as the date where we initiated them on treatment, as well as the age when they were initiated on antiretroviral treatment. Then of course here you have your feeding codes that are there as well. These are very, very self-explanatory. The different types of feeds that are given to the infant. So you just put the code number over there. If you are not so sure, you can actually ask. You can actually ask for a copy of this. If you really want a copy of this, just comment in the section below, then I'll send you a link to the Telegram group if you're not already on the Telegram group, to actually get a copy of this Underfive card. Then, of course, an important notice here is that all children and all infants must actually exclusively breastfeed for the first 6 months. Then, of course, they can continue breastfeeding up until 2 years, especially with complementary feeds. In addition to this, unless if it's medically advised against. For example, in children that are born to HIV positive mothers, we only advise them to exclusively breastfeed for the first 6 months. Then, of course, this should be discussed with the mothers. Then if the child has diarrhea, we should assess the level of dehydration, because you have no dehydration, some dehydration, and severe dehydration. For the no dehydrations, usually we can manage them orally by giving them oral rehydration salts. Remember, we take 1 sachet, we add it to 1 liter of your boiled cooled water, and remember that this water must boil. You must actually see the bubbles. The rule of thumb is that I say boil it until you see the bubbles, roughly about 15 to 20 minutes. Then of course you give them extra fluids. We encourage the mothers to continue breastfeeding the child when they have diarrhea. Now if the child has a cough and they're breathing fast, they're having difficulty in breathing, they're having difficulties breastfeeding as well, then we want to suspect that they have pneumonia, so they have to be referred to a health facility where they can actually be treated or further investigated. We discussed breastfeeding practices with the mother, complementary feeds, immunization, as well as the vitamin A supplementation. We offer them family planning, of course, feeding during and after an illness. We also discuss about safe foods and drinking water, as well as treatment of diarrhea. We discuss about HIV, and we discuss about malaria. On the other side of the card here, we have our nutritional record here. So the record of the visits and the nutritional counseling that was done, the advice that was given, and the follow-up date. Then, of course, you also record here the birth date and, of course, the birth weight you record over there in kilograms. And remember that the child is going to be having these regular visits when they are in the Underfive clinic, like I already mentioned. For example, in the first year, they come every single month. And then, of course, you weigh them and you record the weight of the child on this chart. Now, if it's moving upwards like so, then this means that the child is growing well. If it's horizontal like so, this suggests feeding the child at least 5 times in a day. So if it's horizontal, you should feed the child at least 5 times in a day. If it's downwards, then of course the child may be ill and they need extra attention. Sometimes if you notice that there is inadequate weight gain, such as a graph that is seen here for 2 months, then they should seek medical attention, especially if they have edema of the feet, because this may be pointing us towards malnutrition. And remember that you generally want to keep the child here at this green line, above the green line at least. If they go below the green line and go even and cross 2 of these major percentiles, or these major lines, then of course this is a big problem, and this child must be treated, of course, aggressively, and they must be given the right nutrition. Of course, the different feeds that are given here are given all over this chart. They are rather self-explanatory when you actually zoom into this chart. And even here, you have some different milestones that are there with the child crawling, standing up, being able to walk, and all that. These milestones are actually given on this chart, if you notice very well. So this is a chart for boys, the one that is in blue. Then the one that is in pink is for girls. So the back side is the exact same thing. Or rather, this is the front side. The front side is the exact same thing. And then the back side is different because growth of females is slightly different compared to growth of males. I really hope you enjoyed this video on the Underfive Clinic. If you did, consider subscribing to the channel. Hit the bell notification icon to be receiving such notifications of such videos every time I post. And also drop a comment and drop a like just for my support, and of course for the hard work in putting these PowerPoints together, as well as for the YouTube algorithm. My name is Dr. Moses Kazevu, to Zambia and beyond. Until next time, bye bye.